InfantSEE is a public health program developed by the American Optometric Association. It was developed to detect eye and vision problems early in life. We have been proud to offer this program in our office since 2006. A one-time exam is available at no cost to infants 6 to 12 months old. Let's take a few minutes to learn more about InfantSEE and see what happens during an actual exam. Okay, we're going to do some tests that's going to evaluate his vision and the way his eyes work together. And these tests are objective in the sense that obviously I'm not going to ask him, do things look better or anything. I'm going to see how his eyes move, things of that nature. So we'll get started. Okay. All right, the first thing I'm going to do is I'm just going to cover one of his eyes and see if he cries. If he cries, that might mean that there's something wrong with the other one. So I'm just going to do a test like that. That's good. Like that. Oops, they dropped it. Okay, let's pick that up. There you go. That looks good. Okay. Gonna look at this. What is this? A little Jeep. I bet you like cars and trucks, right? Because you're a boy, right? All right, we're just going to cover one eye. See if he follows with his other eye. Very good. We'll do it over with this eye. Now you want to grab it, huh? Nice color. It's red, right? Good. All right. And this is another test here just to see how his eye works with his prism. Good. All right, now I'm going to shine this light in his eye, and it just helps me figure out if his eyes are kind of lined up, and they look perfect there. Looks good. And we're going to do another test here to shine this light in his eye, and actually, if I get an odd reflection, it could be the sign of a kind of tumor, but of course for Carter, he looks great. Now let's see what happens when I get something real close to his eyes. Generally, the eyes should come in together, and we're just going to test, see how it comes. He wants to grab it, which is normal, and his eyes move together pretty normally there. Very good. You may have heard people say they have an eye turn or something. This is something that can elicit that or make it come out that we may not see normally. So most babies like the red finger, and that works pretty well. He's doing great. And we'll check the other eye. Good. Good. Carter, look at the light. I know it's real bright. Nobody likes bright lights. See the light there, Carter? There you go. And one more time. Very good. Okay. And we check all the different quadrants. There's 4 of them that we normally check. Very good. Now for this test, I kind of want to have you put your hands around the side of his head, kind of like a sandwich. Okay? And I'm just going to see if his eyes move. Move down here. Do you see the light down here, Carter? Can you follow the light for me? There you go. How about up here? There you go. You're doing great. How about up here? Yep. And how about down here? Can you see the light, Carter? Where's the light? Now you see it down here? Good, you can free him now. Okay, perfect. Well, so far everything looks great, and one of the main things we want to do is check the health of the inside of his eyes. So you've probably heard the term dilation, so we're going to make the pupils nice and big. So I'm going to put some drops. Now, he's probably not going to let me put them in without struggling, but what we tend to do is just put a few drops on his eyelids and they'll go in. So if you put him in a cradle position, that'll work well. All right, Carter, I know you don't like this, buddy, but we'll get him in real quick, okay? All right. Here's one. Oh, you're doing a great job. And one more time. Great. Okay. All right. So now, after his pupils get really big, I'll be able to look in the back, make sure everything's where it should be and everything looks healthy. So we'll wait about 15-20 minutes, and then we'll come back and examine and finish up. Okay?
That sounds good.
All right. Great. All right. He's probably going to want to grab this, but we'll do our best to avoid that. So Carter, just look right at me. You're doing a great job. All right. Great job. Carter, just look at me. Good. Good. They always want to fight. Okay. Good. All right, now let's test that other eye. Keep looking at me. You're doing a fine job. Good. All right. Good. Oh, he wants to grab it. Oh, it's going to get in your mouth, huh? All right, Carter, look at the light. I got to hide it from you. There you go. You may want to hold him a little bit more, Mom. Hold him a little bit tighter. Good. Oh, Carter. You may want to hold his arms down. Yeah, sometimes we have to do that. That's not, it's pretty normal. Okay, Carter, look at the light. And there you go. Now we're getting good. Okay. He's a little far-sighted. We'd expect that at his age, but nothing where we put glasses on him or anything like that. Okay? All right, now I'm going to use 2 different instruments to look in the back part of his eye.
Can we hold his arms again?
No, because I'm just going to look in his eye. Okay, Carter. Yeah, good. Good. And one more time. Okay. Yeah. And generally, sometimes they like to look at the light, sometimes they don't, but we'll just do our best here to make sure all the structures are where they're supposed to be, everything looks normal, things of that nature, okay? All right. Very good. You're a good patient. Because you don't know what's going on just yet. Everything looks really good there. And just one more thing, I'm just going to shine this light in his face, just take a general look at his eyes and see everything looks pretty normal. No clogged tear ducts or anything of that nature. Okay. Okay, well I would say the health of his eyes and the vision, everything is perfectly normal. Normally I'd recommend come back around 3 years old. We'll do a few more tests. At that age, they'll know letters, numbers, or shapes, things like that. And definitely before kindergarten, we want to check out before he goes to school and make sure everything's healthy and normal. Any questions for me?
I don't think so. Thank
Great.
you so much.
You're welcome. My pleasure. Great.
We decided to get Carter's eyes checked after hearing about the InfantSEE program through Dr. Subramanian.
Preventative health care is very important to us, especially with a young child. We're very concerned about his health, no matter what it be, whether it be eye exams or health exams. So for us, it's an important issue, and we want to make sure we take care of it early.
Well, the fact that this was a free exam and it came at no cost to us was even more of an incentive for us to get the exam done earlier rather than wait for a problem to occur.
Well, when we looked for an eye doctor for Carter, the most important thing was for us to walk in and feel comfortable with that person right away, and we certainly felt that way with Dr. Subramanian on our first meet. So.
Well, I'm a teacher, and there are a lot of new moms at my school, and I definitely plan to let them know about my wonderful experience that I've had, and also let them know that the InfantSEE program is at no cost to them.
I was very excited to hear that his eyes were normal and that everything was okay.
And as a mother, I tend to worry about everything, so knowing that his eyes are okay makes me feel very happy.
If you'd like to schedule an InfantSEE exam, please let our staff know. Thank you for trusting us with your eye care.